And what are the advantages of ICSI?
So advantage of ICSI is, of course, to do IVF, you have to have a minimum amount of sperm, healthy motile sperm, which means if sperm parameters abnormal, if there's a male factor infertility, if sperm concentration is low, motility is low, morphology is poor, then you have to do ICSI because you do not have sufficient, simply you don't have a sufficient amount of motile healthy sperm for IVF. So you have to do ICSI. So ICSI can get you out of the situation where you have a poor sperm quality, so poor sperm motility. So for example, in IVF, depending on the clinics, so in IVF you need to have at least 5 million motile sperm in the ejaculate. So which means progressively forward moving sperm number should be 5 million or more. If it's less, then of course you have to do ICSI. And also you can only do ICSI if the patient has a TISA or TZ procedures, because those sperm haven't gone through full maturation. They're not motile enough, mature enough to penetrate the egg and fertilize. So you have to use ICSI for that. So, and also in patients with anti-sperm antibodies. In some patients, especially in patients who had a vasectomy reversal, so some patients with testicular trauma, they can develop antibody against their own sperm, and which means sperm may not be able to bind. And some couples have anti-sperm antibody because the egg can produce antibody against their partner's sperm. So in this case, you need to do ICSI because in this situation, sperm really struggles to bind to the surface of the egg. So if you do ICSI, you just take the sperm and put inside the egg, which means that egg cannot reject the sperm because antibody reaction happens on the surface of the egg. So yeah, in difference between IVF and ICSI in terms of method is in ICSI, scientists or embryologists selects a healthy looking sperm and injects the sperm into the egg. So here, so which means you don't need a lot of, let us say if you have 10 eggs, mature eggs, then you need to pick 10 healthy looking sperm. So that's why even if sperm concentration is so low, you can still do ICSI and get good quality embryos and successful pregnancies. So these are the main advantages of ICSI. And also additional advantage of ICSI is what happens in ICSI is after the egg collection, within 2 to 4 hours, so using chemicals, you strip off the eggs from the surrounding those cumulus cells. So you can directly look on the surface of the egg. So you can actually, you don't have a cloud of cells, you can directly see the surface of the egg and you can assess the egg morphology. Morphology means appearance of the egg. Human egg is like any other egg. So healthy eggs like transparent, round shaped, with a very good tension on the membrane without any dark spots and defects. So these are healthy eggs. If you start seeing different inclusions inside the cell, inside the egg, if egg membrane is very soft and you have a lot of defects on the surface, a lot of dark spots, shape of the egg is not normal, like not round, that indicates this morphology of the egg is poor. So that may give us additional information to the specialist. Let us say if you had a good outcome, excellent. If you had a poor outcome, if you're not sure whether it's because of sperm or egg, then if egg's morphology was poor, then you assume actually egg quality was also very likely quality was also poor, which you cannot do this with IVF, because in IVF you cannot see actually the surface of the egg. So, and in ICSI, when egg is fresh, removed, aspirated, you can see the surface of the egg and you can assess and gives additional information to the specialist to understand your IVF cycle.